everybody, I am so excited to introduce you to my good friend and Dr. Stephen Soar, who is a naturopath here in Scottsdale. He's located at Mountain View and 90th Street. It's called Source of Health. And I am so excited we're finally getting together to talk.
I know, it's been so long. We've been planning it for so long.
For so long. And Stephen and I initially met because he teaches yoga at the Village and is one of the most amazing yoga instructors I know.
Thank you, thank you.
But then of course you've continued to take your vision of health, beauty, inside and out, and
absolutely. It's been a work in progress, and every layer just adds to that. So I really try to offer here at the Source of Health just quality care where you're actually getting health care instead of this 5-minute visits where you're in and out the door.
Exactly. So nowadays you go to your doctor, they see you for 2 minutes, they have no idea who you are, and they write you a script and off you go. And we all know that that's basically just putting a Band-Aid on the issue.
It's all Band-Aid treatment, symptom, symptom, symptom. We aim to treat the cause. So my quality guarantee is that I never see any more than 10 patients a day. That means I get one-on-one time with you. You can open up, say as much as you like. We can spend time in working through things. Whether it's physical for pain or we're dealing with some energy or aging issues, we really have time to dive into that.
I love that. So today, I know that, we get injured. I'm at the gym, you're at the gym, you see injuries all the time.
All the time.
And we go to the doctor and the doctor says, let's cut.
Right.
And I know from having 4 shoulder surgeries that getting cut doesn't necessarily fix the problem.
Right.
And sometimes there are better ways than cutting.
And I was there with you the whole time as you're going through each one. I remember the first one, and the next one, and the next one. And it really sucks to be cut because then you have that sling and you can't move it at all.
Right.
For months.
Right. And ironically, a lot of people get better by just not moving it and not getting cut.
Right.
So you also have some alternative things. Sometimes you do need other things, not just rest, but you have some preventative things.
Absolutely. Great treatment. So I have advanced training in regenerative medicine. So the body has the ability to heal, like if you cut yourself it heals. But sometimes down in the deeper areas like inside of a joint or your ligaments or tendons, there's very poor blood supply. So every surgeon will say, well, that's never going to heal on its own. Right. They're right, it won't heal on its own because there's no blood supply to bring in the healing nutrients to make it all happen.
Which was one of the hugest problems with my shoulder, is there isn't a lot of blood flow there, so the healing process wasn't happening. Even after they cut it and supposedly fixed it, it wouldn't heal because there was no blood flow.
Exactly. So the way I explain regenerative medicine is like lawn care. If you want to take care of your lawn, you want it to be really healthy, you're going to water it, you're going to feed it, and you're going to seed it. Okay, so very, very simple. So we have 3 levels, and that kind of goes like mild, moderate, and severe injuries. So you have kind of a middle of the road problem, so we're going to work on feeding it. So we're going to give it fertilizer. So what that means for us today is we're doing platelet-rich plasma. So PRP for short, platelet-rich plasma. We take a small blood draw, we spin it around, take out our platelets, and that goes into the tissue that's damaged or injured. That's going to help it repair and regenerate. So we can add new collagen, that protein, to your ligaments, cartilage, tendons, and then we even have it for aesthetic applications.
I was just going to say, so PRP, I'm sure you've heard it running around, and we're doing it on the face, and we're doing it on the shoulder, and we're doing it on the knee. And that's kind of a great place to start with pain or also with age prevention.
Yeah, and maybe we can do another video, have you back, and we can do some of the aesthetic work here too. So
I'm always up for aesthetics.
I am PRP everything. So we also have stem cell injections, and that's for that severe injury where somebody has to go in for surgery and they don't want to, and they want to prevent it or at least prolong it as long as possible. We have incredible science now of stem cells. Stem cells are the grass seed, right? We add new grass seed to the lawn, and you can get it to refertilize itself with the PRP and get good irrigation, good blood flow. We have a great healing response. It's amazing. It's just what I've seen in my practice is just dumbfounding. I'm very, very blessed and honored.
It's amazing the way technology is going. All right, well, let's show them what this looks like. And all right, here we go.
All right.
Okay. Why do I find myself here getting blood drawn all the time? Poked, prodded, whatever.
Yeah.
Okay, Stephen, you ready?
I'm ready to go.
Okay.
All right.
Okay, so Stephen is drawing my blood to get the platelet-rich plasma, and then he's going to spin it so that it is all ready to be re-injected back into my shoulder. Okay, everybody, Steven is just now getting ready to inject the PRP into my shoulder. We just spun the
blood down to extract the platelets, and we're going to first use a little anesthesia to numb the area up, and then we'll add the PRP in right afterwards.
Ah!
So exciting! This is a regenerative medicine.
Here we go.
Yeah, using the own body to heal itself.
Okay.
That's exciting.
Let's do it.
Here we go.
I'm ready.
Okay, so he is first starting off by using an anesthetic to numb my shoulder. So he's injecting all around those trigger points that I need to have relief in. And then he's going back in with the PRP and injecting it. And as you can see, we're having a good time. I'm not in any real pain at all. Easy, easy, easy.
Yay! Okay, so we are done, and that really didn't hurt at all. Now, Steven is offering always a free consultation if you want to come in and talk to him about any of your aches and pains or hormonal issues or anything. But on top of that, if you are a candidate for PRP, you will get 50% off your first treatment. So that's amazing.
Yeah, I want to be able to help people and spread the word a little bit about this. Regenerative medicine is great. So today we did Julie's rotator cuff, so all of the muscle attachments for the rotator cuff to keep that thing strong and stable. All that repetitive use and overuse from Julie? No. You all know Julie. So she'll be stiff and sore for a couple of days, and then over the next few weeks it's just going to get stronger and stronger. So
yay!
That's it.
I can't wait. Super easy. Steven's amazing, and I will post all of his information below. And again, if you have any issues that you need to talk about, he's the guy. It's definitely the place to start. So come and meet him. You'll love him.
Thanks, everyone.
Have a great day. Bye.
Bye. Not bad. Bam. Good stuff.